I can't imagine anything more fulfilling than this. I have a little girl that's almost 10 years old that in terms of her very active, very happy, fun life, she's going to be a great patient. However, when I asked her about some of these symptoms, it turns out that she has night terrors, nightmares. Almost every night she dreams that somebody breaks into her house and kills her family. And then to say, wait a minute, if you use this appliance and you are able to have that proper oxygen flow and REM sleep, we can take care of that. And the look of relief and excitement is just phenomenal. To change a life to that degree, and to think that if you can't do that, or if you don't do that, they go on that way. I mean, it's an enormous opportunity to impact lives in a deeper way than anything you've ever probably done before, and to do it widespread.
My staff gets excited over doing a Healthy Start case versus doing, 3 CRAC restorations in 2 hours. So what I do like about this is that it is 30% doctor time and 70% assistant time. So it really makes it fun for the staff to get more involved. They get to know the patient, they get to know the family. And the kids, so from the first appointment, for that child that maybe had ADD or ADHD and couldn't sit still in your dental chair during a cleaning, it's the child that comes back and starts to tell you about their day and what, how they got an A on their spelling test or where they're going on vacation. I think it makes dentistry more rewarding, and I think our profession needs this. I think you as a dentist or a dental provider, you would be missing the boat if you ignored the system, because I think it's something that needs to be incorporated in every dental practice to evaluate and be aware of it and to look for it.
We say it's the technology of our generation, and you're a mother, it's helped your family. I'm a grandmother, it's helped mine. You're a doctor, you can offer this treatment and change lives, but you also wear a different hat. You manage your business.
I think with the way that Healthy Start is set up and with the lab fee for it, this is definitely a lot easier than Invisalign, I'll tell you that. It is, the support I think that we get too from home office is phenomenal. There are some times when in the beginning I had a case that wasn't tracking, and actually Dr. B himself called me and we went over the case. And it's him. If you call Invisalign, you're going to get somebody, I don't know what country it is, but maybe that doesn't know your case. But I think that's where the difference is, that Dr. B looks over every case, and if something isn't tracking, they're open to finding out what doesn't. It is a different kind of dentistry where instead of just filling the tooth, check the bite, you're done. This is going to involve more participation, either from the doctor or the assistant, but it's not stressful. It's just trying to figure out. You're going to have to think out of the box. You're going to have to say, what's going on with this kid? Do they come from a 2-family home? Are they traveling a lot? Do they have too many things in their day? You're going to have to find out how to incorporate. Every case is unique. And that's where I think, I've helped other doctors. So if anybody has a question, I always try to help them out. But that's where you work together, find a solution. And I know that if any dentist is taking any team building thing, it's a collaborative effort. So whether it's in your office collaborative effort, or with its other dentist collaborative effort, or if it's calling home office, that support is there. So I think you need to find out, what works in your practice.
And Diana, in terms of a very general application to dentistry, where is sleep going? Where is everything regarding sleep going for this profession?
Well, I think, and I just got back from a 2-day seminar at Spear, and I'll tell you, it's not going away, unfortunately. We all know the billion-dollar industry of sleep therapy as far as CPAP. And I think this is where you can't ignore it. It is here. It's in our chairs twice a year. We need to look and ask. Part of our new patient paperwork, whether they're an adult or child, we have a sleep questionnaire. And the thing is, we didn't ask those questions before. And I have patients that have followed me 3 times in 3 different locations until we bought our last office. And, they're wondering, like, why am I bringing it up now? And I have parents that come and say, why didn't my pediatrician tell me? Or why didn't my pediatric dentist tell me? And the thing of it is we didn't know what we know now. And I think if you become that dental office that is on the forefront of research, what's going on with the developments in medicine, just like how we are with technology. I don't know, more dentists now that I know, we don't take impressions anymore. and that's the way I think dentistry is going. You cannot ignore sleep. Whether you treat it, you refer it, or you evaluate it, you have to look at it. And I think it only makes you a better dentist if you're open to it.